Hey folks, good evening. I like to start pretty close to being on time, so we will get started in about 30 seconds here. All right, 30 seconds is up. Good evening. Tonight, we're going to talk about maintaining long-term career growth and satisfaction as an APP in sexual health. Now, it matters because nothing else matters more. When it comes to healthcare, in all sectors of healthcare, people are leaving. That is just a blatant fact. So as we train people, it is a necessity that we keep them in healthcare. But even more than that, with all the job openings, whatever specialty takes some time and effort to say, hey, in sexual medicine, we want to train you. We want you to be part of our group. Come on in, let's learn together. Those specialties will be the specialties that win. And folks, that is an opportunity for our society and for our specialty. Tonight, we're going to tackle three main topics for each of our esteemed panelists. I really want this talk. We've had several webinars in the past and in-person lectures discussing advice, tips and tricks for advanced practice providers. We all know that it is so critical to integrate APPs into our practice. So folks, that's not actually going to be the focus of tonight's talk. We're going to have a conversation, somewhat of a fireside chat, think TV show. I'm interviewing, I'm moderating, and I'm going to be really asking each of these three all-stars about their own personal experience. We're going to talk about what they've done, some of the barriers that they've faced, as well as what is still left in their bucket list from an early, mid, and late career advanced practice provider. So let's start with some introductions. I'm Amy Perlman, and I'll be moderating tonight's session. My role is to keep us on time. I'll be keeping an eye on the clock. We will end promptly within the hour, if not sooner. I will also keep an eye on the chat box. So if you have any questions, concerns, or grievances, the easiest way to get those to the group are through the chat box. If we don't have time to address some of those by the end, then just we will address those via email at a later time. Now, for introductions, we're going to start with Stephanie. So Stephanie Robertas, I actually had the privilege of working with Stephanie when she was a PA student at the University of Iowa a couple of years ago. And she was the very first PA student to rotate through our 2-week men's health rotation. She now works for a wonderful urology group in Reno, Nevada. And she gets to work in the clinic, inpatient, in the operating room, and she's now 18 months into her career and first job out of PA school. So let's raise the roof for Stephanie here. Next up, we have Cynthia Benarchik. She is an assistant professor at St. John's College of Nursing and a graduate FNP program in Springfield, Illinois. She's a men's health specialist with 10 years of experience working in an academic center. She is a very active member of the SMSNA and a prior chairperson. Another raise the roof for Cynthia. And last but not least, we have Ken Mitchell. Ken is a proud graduate of the University of Nebraska PA program 27 years ago today. So that deserves a round of applause. He is also the founder of Gynecology, and we're going to get into the details of what that has meant for healthcare in general and his goals for the future. And he's an incredible advocate for the health of men and people that care for them. We're going to start with Stephanie. Now, the highlight, her main point with her discussion today is the critical component of men's health exposure during training. Stephanie, let's talk a little bit about your experience as a PA student. You were going through PA school in the midst of COVID. You had to find so many rotations for yourself. How did you navigate that process, finding different rotations? And how did you choose urology men's health?
Oh man, I feel very lucky that my first urology rotation with you was pre-COVID, in which case my program had set it up for me already. And I feel very grateful that I was able to make connections with you and with the urology team during that rotation, which really helped out later. During the pandemic, things constantly shifting in terms of COVID numbers, some rotation sites suddenly getting shut down. It was wonderful to be able to know, I can always go back to urology. If I don't have anything going on right now, I can see what Dr. Perlman's up to, maybe be on call with her. Had some really good times doing that. I found that during that time, it took a lot of me kind of pressing people to say, hey, can I please do this? Kind of taking the initiative on my own to look for opportunities. And I got a lot of no answers, but urology, men's health, the answer was always yes. Everybody was so eager to teach me things and help me grow, even if it took extra time out of their day. And that's one of the reasons that I really felt drawn to urology, feeling like I was actually part of a team and that I could see myself doing that in the future.
Yeah. And Stephanie, your day-to-day now actually involves a lot of inpatient and OR experiences. And so, when you asked me, hey, you're on call next week, can you call me if you have a case? I mean, you helped me debride a Fournier's, you played a critical role in that case. So how did some of those like non-rotation experiences really change, the opportunities that you have today, or what you decided to ask for in your new position?
Yeah. That's something that, a lot of the inpatient side of things in the surgical specialties isn't necessarily built into your rotation as a physician assistant student. But that's the side of urology that I really fell in love with. And that's something that gave me the confidence as I was interviewing for jobs to say like, hey, I would like to have a role where I'm involved in inpatient care and be able to reference experiences. I've been involved in caring for patients with Fournier's gangrene or, managing stones as an inpatient and that kind of thing. And I think had I only had kind of the clinical experience that had been set up, I think I would have missed out on that whole part of urology. And that's ended up being one of the parts that I love the most.
Mm-hmm. Now let's talk about your current job. You've been there for about 18 months. And you are rocking and rolling. And when we were chatting recently, I asked you, what are some of the critical components of your early job satisfaction? And you mentioned a big one, which is mentorship. And you trained at a big academic center. In fact, you graduated from the #1 PA school in the country. And I think a lot of us are taught in training, if we want to learn, have lifelong learning and innovate and be curious, we have to be in a big academic center. And what's been your experience, though, when it comes to mentorship in a very private practice?
I feel really lucky. The group that I'm with is phenomenal. I'm not the first PA to be part of their practice. I think I'm the 9th or 10th even. And so going into it, all of the MDs were very aware of what a new graduate PA knows and what they don't know and what they're able to do on their own and where they still need help. And so there was never an expectation that I should be there already. They knew that despite my experiences as a student, I was still going to need a lot of training to become somewhat competent as a PA. And I'm very grateful that all of the MDs that I work with love taking time to teach me things. I never feel brushed aside. I feel like everybody's invested in my growth as a PA. And that's really helped my job satisfaction as well, feeling like when I encounter something new or a patient comes in and I'm not sure what to do, I can go to anybody and ask them for help and get the answers I need and even get pointed towards resources that I can use to find even additional answers. And feeling that support, I think, has been huge for me, especially early on in my career, knowing that I'm not in this alone. They all have my back and I don't have to struggle through this by myself.
Now, Stephanie, when you were interviewing, you interviewed at several places, and a lot of those programs you mentioned had no history of really working or integrating with APPs. So it seems like for you, it was really important that the practice you joined had some track record of integrating APPs. Is that right?
Yeah, I think so. It's interesting. I think the field of urology has not been as fast as other fields to integrate APPs into their practices. And so as I was on the interview trail, I kind of noticed that the practices that had never had an APP before, they either kind of expected you to consistently function like a first year resident, like you'd always staff your patients with the MD, you would never really have your own clinic, or they would hope that you could just run clinic by yourself while the surgeon was in the OR all day. And neither of those things I felt like I was the person for that job. So I feel like the workplace I'm at now, it's been perfect in kind of providing me that training environment. Certainly nowhere near the extensive hours that you spend in residency, but kind of similar expectations where you kind of progress down the pathway. I started seeing like 12 patients a day and kind of building up my clinic schedule. And even the training for me being in the operating room, starting training with another PA and then having close supervision, kind of a see one, do one, teach one model that is used in residency training. I've been fortunate enough to have that in my own career.
Stephanie, talk to us a little bit about how you worked with industry to actually find your job.
Oh, yes. So when I was working as a student with you, I got to meet Tracy with Boston Scientific. And I knew that for my career, I wanted to move back out west, closer to home. But I was having trouble kind of networking out there on my own. I didn't have any urology connections out west. But Tracy got in touch with Marielle, the Boston Scientific rep in the Nevada area. And she was able to recommend like, oh, hey, I work with Dr. Ross Anderson. He's fantastic. You should check out Urology Nevada. And that's how I even found out about the job, kind of got my foot in the door. And that was huge for me because especially, when I was applying to jobs in early 2021, I think a lot of people had been laid off or furloughed at the time. And it was just really hard, especially as a new grad PA with no experience, just applying somewhere if nobody knew or recognized your name. But being able to connect with people in industry was super helpful for me in getting this first job.
And I don't think we talk about that enough. I think we think about reaching out to industry for, sexual medicine fellows as they're looking for jobs. But I think we also need to bring up that discussion of how we can work with industry to help our APPs network around the country. Cynthia and Ken, have you worked with industry or, have had similar conversations regarding this similar topic?
Okay.
I think industry has been great, even locally. Whenever I have a question, for me, being mid-career and being kind of settled in a particular practice for 10 years, when I decided to make a move into education, it was really hard for me to do that because I was like, well, do I want to go work someplace else? Do I want to go into education? What do I want to do kind of mid-career? And so I had a lot of conversations with different reps, and they were very helpful about, well, hey, someone's looking for a NP here, an APP here. And so it gave me room to kind of think about what I wanted. Do I want to move? Do I want to go to a different practice? Is education something I want to move to? So I think they were helpful in providing me opportunities to think a little bit outside of the box. So I've always appreciated where industry has been willing to help in that way.
Yeah, I agree. The industry was really integral, if not vital to my growth when I first started. I was fortunate when I landed my first urology job. I had Boston Scientific, AMS, and Coloplast, all in my backyard. And so at that time, we were actually closing, an APP, highly functioning APP in a urology practice with partners. And they helped connect me with a lot of not only physicians, but APPs around the country. Also, a role in my moving forward into leadership of that nature. So fast forwarding today, I can imagine, if any of them are watching right now, I guess I'd be in trouble if I didn't say. They've been huge supporters, both in their time, their energy, and their resources to help me realize a lot of the things that I want to do for myself.
Absolutely. Now, Stephanie, let's get into a little bit more of your early career satisfaction because you're 18 months in and we want to keep you for the next 30, 40, 50 years, right? So you mentioned, or you talk a little bit about being a disease state champion. And what is it? You are the ED champion, is what I hear. That's the rumor on the street. So tell us a little bit about the champion system came about and how that's contributing to your early career satisfaction.
Yeah. So early on into my joining the practice, the MDs had, they have biannual meetings with all of us PAs where we just talk about how things are going, what we're interested in, what they're interested in. And one thing that MDs had brought up was whether or not we kind of want to even subspecialize within the field of urology. Like one of my colleagues loves interstitial cystitis, and one of my colleagues is very interested in helping patients with overactive bladder. And we were kind of finding that new patients were getting funneled to certain, MDs, of course, but also certain PAs, depending on who kind of was the go-to person for certain chief complaints. And so the MDs had proposed, well, here's kind of our disease pathways. You have our BPH pathway, OAB, et cetera. And kind of offered it to us, like, who's interested in becoming a champion of this pathway. And that is something that, after kind of clarifying our interests, now a lot of our new patients fall more into the category of what we're the champion of. And we're also responsible for helping to put together educational materials for the patients and stuff like that. So I think that's been really rewarding to kind of, even especially being a new PA, kind of feel like, okay, here's a diagnosis where if I see a lot of this consistently, I feel like I can master it faster and have more job satisfaction in that way too, like not feeling like I'm struggling constantly, which, I mean, I still do, but feeling like, okay, I'm getting the hang of this, seeing kind of the same thing over and over, and then kind of expanding what I do from there.
I love that. Cynthia and Ken, how did being a champion in various men's health topics, how did that contribute to your early and mid-career satisfaction?
I know for me, that was went into it, just for personal reasons. Actually watching some things happen with my father that got me into it. And in the process of that, that little blue pill came out, in 1998. And that just smoked out all kinds of things that I saw, and realized it was overlooked. Basically, it was just something that very few people were really championing at all. If anything, it was almost like a fad, like ED became weight loss, like, oh, we can do this, you do that. But then we started realizing that it was a much more serious illness than we realized, starting making dots like that. And so, you realize, though, the funny thing about, ED alone, what you realize when you pick that one, I love it. And, I think that's a great inclusive term, if you will, for everybody to do it. But when you realize these things really impact people's, not just their quality of life, but their actual lives itself, it's really easy to if you're passionate about just really having an impact. I mean, more than anything else. So.
Yeah, I would say that when I started, I entered my profession knowing that I was going to be doing men's health with Dr. Kohler. So I would say for me, later I would say probably like 4 or 5 years in, we started to treat for Peyronie's with Xiaflex. And so I kind of became the go-to person over several years for Peyronie's. And so I kind of built my practice over the last few years as the Peyronie specialist. And so I was the only one in the office doing that. And I would have patients drive 3 hours to see me because I was one of the only few people in the area that was providing Xiaflex for patients. And so I'll just echo what Ken says, is that, when you're providing a service to patients who really need it, it's very gratifying, and it makes, doing what you do even better, when you're helping patients and you enjoy what you're doing and you're kind of the champion in that area, and people know that they can go to you for advice and they're seeking you out. There's gratification in that for sure, and job satisfaction. So I think finding yours, kind of your niche, Dr. Kohler used to just say, find something that makes you invaluable and that you enjoy doing. And so for me, that was Peyronie's. I really found I had good job satisfaction with that, because I really felt like I was making a difference. It's really satisfying to see someone who comes in devastated with a 90-degree curve, who 6 months later leaves your office and has a functional penis again. That's life-changing.
And what I find to be really amazing, as Stephanie was talking about, is when we ask each person, what do you like to do? And what do you like to do? And what do you like to do? Everyone likes their own pain. And then everyone wins. The patients win, the providers win. No one's saying, darn, another, ball pain patient on my schedule, but everyone wins. And maybe the first start is just asking people, what do you like to do? What do you like to see? What procedures do you want to do? And it really could be that simple. So Stephanie, to wrap up with your section here, what are your goals? So goals for kind of the rest of your early career, but what are your plans for mid and late career?
Well, certainly, kind of right now being early career, I'm still kind of in that stage where I feel a little overwhelmed and I feel like just a complete idiot that doesn't know anything. And so a lot of my goals right now are focusing on not only improving my skill, difficult Foley placements, learning cystoscopy, et cetera, but also improving my knowledge base. But sort of later on in my career, I definitely want to get more involved in the education side of things. My men's health rotation, it was kind of a fluke how I ended up doing it. My PA program rotation advisor was like, hey, you could do urology or you could do men's health. Which one do you want? And I was like, men's health, sure. And it ended up being the best decision I ever made. And I learned so much that is relevant not only to urology, but also to so many other specialties. And, seeing a lot of these men that come in to see me and realizing that there's kind of been a deficit in their care, and they often aren't educated enough to even advocate for themselves. Like, no man's going to ask for a rectal exam at their primary care doctor's office. And, I feel like educating other people in men's health, regardless of whether they choose that as their specialty, would be so huge in helping these patients, not only when they see us urology specialists, but also, educating everybody else so they can also be on board with our mutual goals to take care of these men. So getting involved with a local PA program, I think in the future, as well as, maybe some advocacy on a national level at some point. But yeah, those are definitely what I'm going for.
Awesome. Well, Stephanie, thank you so much for sharing about your experience. And next up, we're going to get to Cynthia. So Cynthia's main goal today is to share with us, be present everywhere. Cynthia, tell us more. Where do we need to be present at the institutional level as well as in the community?
Yeah, I think it's important to just be present in your institution in several ways. So I think it's important to be involved with everything that's going on in your department, whether it's a journal club, educating staff, like Stephanie said, creating patient education. Those are all great things. I also think it's important for APPs to be present at every event that is going on at your institution, whether it is an endowment, a dinner, just anything. I can't tell you how many times that I would go to any one of these events. Maybe it was an opening of a new department or an endowment dinner, and I was the only nurse practitioner there. And so it was a real opportunity to be able to say, hey, I'm Cynthia. I work in urology. My specialty is men's health. And then you can kind of let everybody know that you're there, and then also let them know what your practice is and what you can do and what you can provide for the whole institution. So I think as you move along in your career, it's important to be seen. And those are just some small ways that you can be seen. And then also participating in publishing, if that's an interest. that was kind of one of the things that Dr. Kohler was very instrumental in helping me with, setting goals, whether it was like, 1 year, 3 year, 5 years, he said, what do you want to do? And I thought, well, gosh, I don't know. I just got here. I'm not sure. I'm men's health. And so, I said, well, yeah, I'd like to be published, I think. And so I started helping the residents with some of their research, doing lit searches, entering data. And then it was, hey, can you edit a book chapter? And then can you do this? And then, once you start doing that, then more doors start opening up. So I think that's kind of what I mean by just being present, is just looking for opportunities that you can be useful and make a difference.
Now, you spoke a little bit about your discussions early on in your career with Dr. Kohler about defining those goals. So, what's the importance of the 3, 5, and 10? How did that set up your early and mid-career?
That's a great question. So I think it helped me just kind of build a scaffold, right? So I was like, first, I just want to publish, or just, show me how that's done. I didn't even know that there was a difference between a first author and a last author. And so when we kind of marched it out, I thought, then I went to SMSNA. So I was like, okay, I want to research. I want to be published. And then I went to the SMSNA and I thought, oh, I want to present someday. And then the more I got into the SMSNA, I started going to different conferences, and it was like, yeah, I can present. Yeah, I'll present some research. I'll do this. And then I was like, yeah, I think I'll join the APP committee. And so over the last 10 years, I have fulfilled every goal that I wanted. I've published, I've reviewed book chapters, I've served on the committee, I've served as a chairperson, I've mentored, I teach. And so I really feel that having those goals and knowing exactly kind of what you want will just help you progress. And that's also helps with job satisfaction too, especially if you have, like Stephanie referenced, a good support team, people that you can go to and people who are champions for you. Because sometimes that's not always there, and it makes it a little bit more difficult to obtain your goals. So, if we run into some of those barriers that we've talked about before, that makes it a little bit more difficult.
Now, you touched a little bit on branding and making yourself invaluable. Can you talk a little bit more granular in terms of things that you've done when it comes to these non-work related opportunities, politics, societies, and industry? Tell us more about that and your involvement.
Sure. So I think when it comes to kind of branding yourself, it just also means being vulnerable and taking risk. So I just started asking for opportunities, and like I said, the more you do, it kind of comes to you. So I think for me, it was saying yes. I had a year where it's like, I'm just going to say yes to everything. And so, when Stacy, or not, sorry, Tracy from AMS, she said, hey, there's going to be this women in medicine at SMSNA, you want to go, let's do this. And so I was like, sure, yeah, I'll try that. And so, then that you're part of that program, and you're meeting all these wonderful women in medicine and in urology. And then there's, endo, right? So they took a big interest with the APPs over the last couple of years. And it happened to be when I was chairperson of the SMSNA. They said, hey, we want to sponsor some webinars. We want to be really involved. And it was kind of overwhelming at first, but then I was like, this is awesome. For the first time, we have industry who is looking at us. The spotlight is on us. So we need to kind of seize the moment and just take part in that. So I just think it's being open to different opportunities and not being afraid to just say yes. Even if you still have imposter syndrome 10 years later, you just say yes.
I love that. Now let's talk about some of the barriers or challenges that you've come across and have navigated through. So you earned your advanced degree. Talk to us a little bit about getting your advanced degree, while you're working, lifelong learning, and this path to promotion. What are some of those challenges?
For me, well, of course, just working, full time in a clinic is demanding. And then, the challenges of academic rigor in the evening and writing, whether it's a thesis or a doctoral project is daunting. But for some, I think, especially for me working in an academic center, one of the barriers that I came into, that I met, was that obtaining that degree didn't mean that I was going to make any more money. It didn't mean that I was going to have any more access to advancement within the company or the institution that I was with. So there wasn't a path for me to become like an assistant professor or associate professor or just be more involved. So that was a little bit frustrating. So I really just had to kind of realign my personal goals. So getting a DNP or my doctorate became more personal than it was professional. And I think that it may depend on the academic institution that you work, with, because I know that there are other institutions that do have APPs with advanced degrees who do serve in as faculty. So I think it just depends on where you work, but that can be a barrier. At least it was for me. And it was a little frustrating too that there wasn't a pay increase, but I'll be bitter about that the rest of my life, but that's okay.
How do you think getting your advanced degree, like what opportunities does it open for you, whether it's, related to work or outside of work?
Yeah, I think that for me, it's opened kind of an opportunity for a side hustle, and also kind of alleviates a little bit of boredom. So I was able to teach as adjunct at some of the universities in the area. And so that kind of broke up the monotony of, clinic day in and day out. And then opened up some also other opportunities for research that I, wouldn't have had previously. So I think that just having an advanced degree, or even just making the most of the working to the top of your profession, right? Utilizing every skill that you have is just important at any stage of your career. And I think I don't know how to say it. So I think when you outgrow where you are, it's time to go. If there's no more room for advancement and you feel like you have kind of reached all of your goals and you've done what you can do, I think it's also important to recognize that it's time to move on and do something different that's going to bring you joy and is going to make a difference.
I hear you. Amen to that. Actually, 3 of us, between me, you, and Ken, have all made a lot of career changes. And sometimes just
And that's
wanting something
scary.
different is reason enough to change jobs.
Yeah.
But oftentimes the people, speaking at the podiums are the ones that have said, you know what, I outgrew that other position, and I went somewhere else. And like, those are the really interesting people with the really interesting stories. So Cynthia, what's next? So, we call it kind of like mid-career. We can call it the next phase in your journey in your life. Talk to us about what you want to do when it comes to holistic care. What does that look like? What does it look like to take care of your community and to continue with education?
For me, it's education, right? So I like academics. I'm going to continue to teach at the doctoral level within the community. I am looking forward to hopefully opening my own practice. Elise Foss-Knight is kind of a mentor in that area. She's a rock star starting her own business. So there's a little bit of motivation and excitement when I see someone else doing that and say, oh, I can do that. Maybe I can do that too. So I've been working on a business plan and been thinking about opening up a telehealth clinic, specifically telehealth, because I think that provides more access for a lot of our rural area patients, living in the Midwest. We have a lot of truck drivers, there's a lot of men who work in factories who can't get off. They don't have time to take off to go to the doctor, for their erectile dysfunction or low testosterone. So I think telehealth is really important, and it's an area that's, especially in men's health, that's missing in our area. There's nobody that's really doing it. So that's like a 1 year, 2 year plan for me is to do that. And then I like politics too, so I'm following a bill right now that's it's HR 5986. It's a men's health bill. So I'm kind of hoping to see that pass, because I'd like to see some grant money open up for more research in men's health, and then opening up more men's health centers in rural areas or just different opportunities that we can kind of, spread out and just meet the need that men have, the unique need that men have. And I'll let Ken talk about that a little bit more, because that's, kind of where he's going. But for me, it's not working in the clinic anymore. Like I said, 10 years in, I've done what I've wanted to do, and I think I'm just looking for something a little bit different. And I feel that I'm in a unique position to offer that to my community. And also, Dr. Perlman, you and I are going to be working with one of the local colleges, Lincoln Lane Community College. They have an adults kind of a lifelong learning program. And so we're going to be doing a program I think it's in January and February, about aging and intimacy. And so there's going to be 3 webinars about just sexual health, sex toys, different positioning, just so I think, just being involved in the community is going to be fun. That just kind of popped out of nowhere, and it's really, I'm really looking forward to that.
So Ken, as Cynthia is making this career transition, you've done similar transitions many times in your career. What advice do you have for people like Cynthia, for people like me, for others who are making a career transition?
I'm listening to all of you, I've been there at the beginning, kind of the middle area where you're, you've kind of outgrown where you are. I think the biggest thing, it's funny advice, but have a goal but don't have a plan. And it sounds funny to say that, because I think what happens is a lot of times we lose focus and go as we had thought they were going. And I realized that I was doing that over and over and over again. The things that worked. When I sort of thought I had all the answers and I had all these plans to get it done, and realized I didn't know as much as I thought I knew. But when I stayed focused on those goals, and like Cynthia said, that always seemed to have to reveal to you at the point, and then you just run down it, and like a little kid, it's like we're gonna get this there. You get gutsier and gutsier the older you get. I think that's something to do with it too. More weird kind of thing. So my advice really is keep focused on those goals, and don't get caught up, embrace the journey. Don't get too high, don't get too low. Just focus on those goals.
Awesome. Thank you, Ken. Now you are on the hot seat, buddy.
Uh-oh.
And I think when I was referring to your section of this talk and saying, late career, end career, I guess that could come off as a little bit of maybe a little offensive. And you said, I'm just moving to the next phase of my career, which I absolutely loved when you said that. And so, I'm going to say that your main message is embrace new phases, and that could be at any point in our career trajectory. So talk to us a little bit about, throughout your career, what are some of the things that has kept you in certain jobs and roles? And what are some of the things that pushed you away to find another opportunity?
Yeah, so pretty much it's been said already. So if I start at the beginning, I was excited about the opportunity to go into this area where there were very few APPs. And I was like, going, you know what, this is great. I'm going to go jump in the middle of something that, I'll have nobody to turn to my left or my right to talk to. I'm just going to keep going and do the best I can. And interestingly enough, until I was, maybe 4 or 5 years down the road, especially when I went into urology in '05, I didn't realize, like I'm better, like you talking about a lease, you're a pioneer. You don't realize you're a pioneer. You're just trying to stay afloat, right? You're just trying to just do the best you can and make it. And you don't realize the path that you're carving for others. I think one thing I didn't quite understand at the time, and so once that kind of hit me, that part of it was that it changed the way that I looked at it. Like there was a responsibility to not only learn as much as I can, but be good at it. Because I wasn't just representing Kim Mitchell, I was representing all the APPs that are coming after me to say, I want to change the way APPs are looked at. I want the physicians and the practice to say, wow, there's a role that can be served by this group of professionals that we never envisioned before. And so I really got in the habit of taking chances, and do this. But I really, really felt like it was extremely important for me to do I could do it so that there would be a path for Cynthia, and for others that came behind me. So, and then that being said, the more I did it, the longer I did it, I'm looking, you have embraced creativity, that was the thing was, man, your eyes open up to all the possibilities that are out there. And you really sit down and you have a lot of great conversations, whether it be over coffee or in a bar, at a restaurant with your physician colleagues, and you realize, boy, they have challenges. And I start thinking, man, we could do that. We could help you with that challenge. And like you said, it's a win-win for everybody, right? At that point. And I know for me, again, I realized that the whole team can be, integral in all this. I used to tell people, my medical assistants and nurses, I would stack them up against any clinician evaluating a patient. Spend time learning. About 4 or 5 years into my time in Minnesota, I'd sit down every Thursday morning. We just had no clinic, and we spent 2 hours, me and my nurses and medical assistants, and all we did is we talked about how we would treat these patients, and I would teach them about the disease states and, why do we prescribe that? Why do we get those labs? And, I'll tell you, we had fun. We had fun knowing that, we were all involved. We were all part of it. And then we went crazy after that. Next thing you know, we were hiring our schedulers. We had our scheduler come in clinic. You want to know what you're scheduling, don't you? I mean, so, hey, come on, let's go see it. You need to go see a Xiaflex injection. You need to see testosterone put in. I mean, you need to see that this is what you're doing. And so, the old, it sounds corny, but the old saying says, the more you know, the more you grow. That's really what happened. And we had such a cohesive unit that were singularly focused on taking care of people. And it was great. I just really, really think that, the more you do that and the more you like, okay, I've got this down to a science now, then you realize, man, there's other people out there that want to do this. And so really the way you start looking at it, you educate the entire team. Well, my book, all my PA and nurse practitioner colleagues are part of my team, right? So, that's where, the next evolution for me was learn an awful lot. I've been through an awful lot, and there's a lot of people that come behind me. And I can't help you avoid all help you, to make you land a little softer when things do challenges.
So Ken, not only have you paved the way for other advanced practice providers, but this whole concept of really training and advocating and integrating the entire team, in men's health is really revolutionizing the way we treat patients as well. So tell us how you're formalizing this. Tell us about gynecology and what your goals are for that organization.
Yeah, so gynecology. So for those who've ever heard the term before, I think I was 20 years into my practice, over a conversation coming back from Memphis. My girlfriend asked me a question. Um, she said, if I asked somebody what you did for a living, what would you tell me? And I said, so I told her, and she says, oh, you do gynecology, like gynecology. And I started laughing, and I go, all this time I've been doing this, and I never thought of that. The vision itself was always there, but it never had a name. And I'll be honest with you, that was a game changer, because I could walk into a lot of places, where everybody's working right now. And I'd say, hey, I'm here to teach you all you want to know about men's health. That's great, Ken, go away. Right? But if I come in there wearing a t-shirt that says gynecology on it, I don't have to ask anything. They're going to ask me, what's that all about? And,
You have merch?
what's that? Yeah, we do. We got merch. So,
I'm gonna need some merch.
but but the thing was that, again, you start thinking about, like, what's the impact? What does all this have to do with anything? And I realized, we start talking about the evolution of men's health. It's been redefined over the years to be more like age, basically as guys are aging and things like that, and vitality, but not realizing that it impacts their overall health and well-being. But this was the first time we had something that had legitimate healthcare providers and professionals behind it. That was as catchy as Low T Center. That was as catchy as some of these other male clinics that are out there, where people are asking questions, and I said, boy, I get to tell them the truth. I get to say things to them that should make them know their health, and not just saying it to the guys, but to the women. And I'd love to share one thing. I tell you, the first time we field tested it, we were wearing just the first evolution of the t-shirt, walking around Nashville downtown during the NFL draft. We were lucky to get 10 feet without somebody asking us, what is that all about? We had 200 cards that were gone in an hour. The cards, all they said on them was what gynecology was. And they were like, and we talked to people and we talked to them. And I mean, it was just amazing to do that. And it was eye-opening to me, but what kind of an impact we can make. But then I thought to myself, I said, if I create all this interest, I got to also talk to all my colleagues to make sure they're ready to receive all these people that are going to come into their office, asking for the care. And so you start really connecting dots and things like that. And then, psychology for me was about teaching my colleagues about how to do men's health care the best way that they know how, and that way it should be done. I was fortunate to have a lot of physician mentors, who are considered legends, if you will, in the field, who were kind enough to embrace me and what I wanted to do and help me realize my vision. When there was really not APP, they're asking the questions I was asking, and then allowed me to expand, and they embraced it and they've run with it. Cynthia, I remember Cynthia, the first time you presented. I remember the first time talking to her about it, and she was like, no, I don't think I can do that. I was like, you absolutely can do this. And not only are you going to do it, you're going to be awesome at it. And I think anybody's ever heard her talk knows that's exactly what, where it is. And I see the same for everybody else. And then we've been working on research projects. And so we're looking at that, and we're really interested in the thought process that young men have and how they move forward with their thinking as they become adults about their health and well-being. And then next year, we're going to move into consumer education, because I figured, I've stopped a few lines at the airport because people ask me what the t-shirt about. TSA, on the airplane, flight attendant, what is that all about? And I said, maybe we need to take that opportunity to do it, whether it be online or however we're going to do this to help patients. And so I'm a kid of the, of the 70s Saturday morning cartoons. And I've shared this with everybody before, that I said, I want to see Schoolhouse Rock me men's health. That maybe get weird, but you know what? I think it's a great way to get the message out there to our folks. So that's really it. So, educating patients, educating providers, and conducting research to better understand these patients that we're taking care of.
Yeah, I think the beauty of what really all three of you are doing is, figuring out how to really optimize and maximize the care of the patient in clinic and on telemed. But the really fun stuff is the stuff we do after 5 p.m. The really creative and innovative, and really the stuff that's going to change the paradigm of healthcare. And all three of you are doing those things. And so I can't wait to see what comes out over the next couple of years. So we're going to wrap up tonight's webinar, and the bottom line when it comes to long-term career growth and satisfaction are the following. Early exposure in men's health is critical. So figuring out how each of us can educate nurses, nurse practitioners, PAs, even if it's just a couple of lectures, it doesn't necessarily need to be a rotation. Even one lecture could make a difference for our impressionable students. Mentorship in all areas of healthcare doesn't have to be academics, but simply answering the phone and saying, yes, that's a great question, I want to teach you. Mentorship keeps people like Stephanie, happy in their early career. Being seen and heard. Cynthia epitomizes this, not just being present, but also getting the courage to shake someone's hand at a meeting, introducing herself. This is what I do, and I'm happy to help care for the mutual patient. Setting goals, like Dr. Kohler met with Cynthia. What are your 3, 5, 10-year goals to help make, get all those check marks? Not accepting the status quo. I think we touched on that a few times during the session. Just wanting to try something different is reason enough to try something different. Healthcare is changing, and we don't have to accept the current system if we don't want to. So allowing for that flexibility in our careers might be the answer to burnout, and really embracing this next phase in our lives. Being the change, changing the paradigm, and embracing these new phases. Thank you all so much for joining us tonight. Thank you, Stephanie, Cynthia, and Ken. And I don't believe I see any questions, concerns, or grievances, so we will wrap it up there. Jesse, anything that you need to add?
Nope, I believe we're good. Thank you all.
All right. Awesome. Have a great night.
Thank
Thank
you,
you.
Dr. Perlman.
Mhm.